So I'm Daisy, and today I'm going to be doing a forelimb range of movement assessment on Lola. Lola is a 13-week-old lurcher puppy, so her joints are still developing, so you need to be quite careful when assessing range so that we don't push it too far. So I'm going to start distally and work proximally. So starting with the distal interphalangeal joint, I'm going to fix at the proximal interphalangeal joint, and then we can do flexion and extension, and then moving on to the next joint, we've got flexion and extension, flexion and extension, and flexion and extension, and there's no pain response. These movements can also be done globally if the puppy or dog has ticklish feet. So then moving on to the proximal interphalangeal joint, again looking at flexion and extension. So there's quite a lot of extension because obviously when their paw is placed on the ground, it allows the pad to be flat on the ground. And again working through each joint, fixing above and below. So looking at flexion and extension, flexion and extension, and flexion and extension. Moving up to the metacarpal phalangeal joint. So again, globally looking at flexion and extension, and then fixing at the metacarpal and the P1. At the carpus, we're going to be looking at flexion, and this can be measured with a goniometer. So I'm going to place that over the joint and then line it up. And that shows that she's got about 30 degrees of flexion, which is approximately what you would expect, between 20 and 30 degrees. And this has a spongy end feel because the ligaments and the tissue is what's blocking that end of range, and then if we straighten it out into extension, and this has a hard end feel because that's the end of the joint range. So we also have a little bit of radial and ulnar deviation at the carpus, and then extension as well. And of course you see the extension greatest in standing. So then moving up to the elbow joint, you've got flexion and then extension as well. So for extension, making sure that it's fixing above the elbow and below, and then we've got extension. And then we've also got, if I fix above the elbow, looking into pronation and supination, which assists with proprioception of the dog. So then moving up into the shoulder, we've got flexion, so stabilising at the scapula, and then supporting at the humerus. We've got flexion and extension, and then also fixing at the scapula and supporting the limb. We've got abduction, and we would expect about 40 degrees of abduction. If we get more than that, it's likely a combined movement. And adduction, we've got some adduction, but it's limited by the floor being there. Scapulothoracic range of movement. We've got our cranial and caudal glide, and then also our dorsal and our ventral glide, and also we can have some caudal and some cranial rotation. And then looking at the whole limb combined, you've got limb protraction and limb retraction. So to summarise, Lola has good range throughout her whole forelimb and nothing caused a pain response. She's just a puppy, so it's quite difficult for her to settle, and her feet are a little bit ticklish, so it's difficult to isolate those movements in the distal interphalangeal joint and the proximal interphalangeal joint. And just being a bit aware because her joints are still quite loose as she's still developing.